We're getting a clearer picture of what cuts to Medicaid will mean for Virginians. The changes come in the Trump administration's One Big Beautiful Bill. Today, Democratic Congresswoman Jennifer McClellan joined Protect Our Care Virginia to talk about the impacts on the Commonwealth.
My medical decisions should be based on medical science, not politics.
It is real fear taking shape across the state over cuts to Medicaid outlined in what the Trump administration labeled the Big Beautiful Bill.
I actually had a doctor's appointment yesterday to talk about how to manage my care if I lose my Medicaid.
And Julie O'Brien is one of the 300,000 Virginians at risk of losing Medicaid. Deputy Secretary of Health and Human Resources has crunched the numbers on what the cuts could mean to the Commonwealth, estimating a $2 to $6 billion loss in revenue to the state in 1 year. And it's not just people losing coverage, but providers and hospitals losing reimbursements.
The economic harm from losing a hospital in a rural community is beyond just the healthcare needs and the healthcare access. Businesses don't want to move into communities that don't have hospitals.
I hear constituents, not just in my district, but across the Commonwealth, talk about how important Medicaid is to them, whether it is helping them to get home care, contraception, dialysis, dental care, cancer screening.
The Trump administration says the cuts strengthen Medicaid by eliminating waste, fraud, and abuse, and blocks illegal immigrants from getting coverage. But Congresswoman Jennifer McClellan cites another motive.
All to make permanent tax credits and put more money in the pockets of billionaires and, in one case, a trillionaire. On the backs of
And McClellan reminds people the Medicaid cuts are on top of the fact that 100,000 Virginians dropped Affordable Care Act plans after the premium subsidies were allowed to expire.